lower their unemployment rate forecast. And out to 2023, that does suggest, that they might even have to raise their inflation forecast a little bit in 2023, just because the unemployment rate, the labor market is expected to be tighter. So, I do think they will have to move in their projections for interest rate hikes, and again, just on this optionality related to tapering, it argues in our minds, that at least opening the door to a possible September taper, is again a prudent thing to do, from the central bank's perspective. Now we still expect December is probably the most likely outcome, because we do think inflation is transitory and it will start to decelerate in the back half of this year. But again.
All right, folks, and it is that time of the week. It is the Marketplace Show Reset and Jumpstart TV, broadcasting live on WSDX, broadcasting on La Mega Mundial, broadcasting on Tempo Network Television, broadcasting on Caribbean American Passport, and broadcasting throughout social media. I'm Anthony Weeks. I'm the executive producer and host of the Kalaloo Network, and I am the managing director of SETI. This is segment number 1 on health and wellness, and I want to welcome my colleagues. If you see a change, it's because we are making the necessary adjustments as we continue to grow and expand our team and our programming content as well. And so I'd like to officially, formally welcome our new co-host, Yvette Woods, on our health and wellness. Linda and Yvette, welcome to the Marketplace Show Reset and Jumpstart TV. How are you guys doing today?
You're doing great, Yvette. You're welcome. We're going to have to change your title right after the word would be a comma.
Yes.
Host. There we go. So that will make it super official. So for next week, yes, we'll do that. And we're doing great here in the DMV. Last night, there was a massive storm that came in like no other. But today, and it's just so divine, it's beautiful and sunny and a great day. And so we hope that you're experiencing that as well. And we're sure you are down in beautiful St. Croix. So we're channeling that weather and looking forward to a good conversation. Wouldn't you say, Yvette?
Absolutely. I think we should go join Anthony.
Come on, Yvette. Come on, Yvette. Come
on. We have some co-host unity here, right? We need to unify.
Yes. Yeah, we need to unify. I saw behind Anthony because Anthony's looking especially amazing today. Not
yes, he is.
Every day, but he's looking really good. So there's some good things happening with our initiative case, and we look forward to the segments behind us. Right?
Yeah,
Anthony?
yeah. We have. I'm looking forward to your guest, the good doctor, Dr. Byron Williams, our special guest today, and it's his time. His guest appearance is timely because also I did not know this. I just found out yesterday, but the month of June is also Men Health Month as well. Did not know that. And so to have Dr. Byron Williams scheduled today, I don't know if that was by design, Linda, if you did that deliberately. I did not know that, but he's going to be our special guest and contribute on the program today.
Well, after Yvette introduced me to him, and he and I had a great conversation yesterday, I was very excited for our viewers and our listeners because not only is Dr. Williams an esteemed member, a retiree from the United States Air Force, as a veteran, and a contractor with DoD in the human resources space. So he understands what's happening with our workforce and their needs from a health perspective. He is a minister. He is the father of 2 kids. He is an author. He is received his PhD in 2020. And he has a really interesting health story to share, in the fact that he is also a survivor of stroke and prostate cancer. And
Fantastic.
so when we talk about the full men's health, we have the real deal in Dr. Byron Williams. Wouldn't you? I mean, I don't know how else to say it. What would you say? I see Yvette shaking her head like, yes, yes.
And the reason why that means so much and a lot for the work that we do as a think tank, as a macroeconomic and public policy think tank, as we look at the spectrum of those issues and those critical issues that we need to address.
Yes.
And one of them is healthcare. And it really is a testament to the fact that this new segment, or the segment of health and wellness, now has a registered nurse as part of the segment. I don't think people really understand that, and I gotta really put an exclamation point to that, because how appropriate to talk about addressing health and wellness, and to now have a co-host and a contributor that is a registered nurse, and not just a registered nurse. She is a veteran frontline worker, and have dealt she's very involved in the whole fight against the pandemic. And so when we talk about these health and wellness issue, we have someone who is trained, the background in delivering healthcare, medical care to the public. And so when we come to you live on a weekly basis on our broadcasts, whether it's on television, broadcasting throughout the United States, throughout the entire Caribbean, throughout the Latin America, it doesn't matter, because the principle and the dynamics of healthcare and delivering medicine to the public is so paramount to understanding the whole education paradigm, the information. Because if we're going to be victorious, if we're going to win this fight against allowing people of color to become more responsible, to be more preventive in terms of the health challenges that they have, all of that is going to be done through education. Absolutely. And coming to you and having that conversation on a weekly basis on this program. And I want to thank you, Nurse Yvette Woods, for joining the team. And I think our audience is going to be, they're going to get a wealth of knowledge and information. And I want to thank you for being part of the team.
Thank you, Anthony and Linda, for having me. I'm honored. Thank you.
Yes, and absolutely. In my travels and career within the healthcare sector, I was not clinical, but an executive in the healthcare sector. We know in our hearts that those who are in the nursing corps are really the lifeblood of a hospital or a healthcare system. You just cannot function adequately without that bedside support on a daily basis, that's working with and dealing with the patients, the physicians, the family members, the technicians, and really providing that level of navigation, if you will, in how to help your loved one move from front door to throughput to out the door, returning home hopefully well enough to continue their lives, and then with a quality of life. So I echo what Anthony says. I've even, during COVID, here's a little bit of a tidbit. During COVID, one of the things that our business did, Orange Wall Enterprise, we purchased COVID rapid tests. And we decided to open that up to family and friends, no charge or anything like that. Who did I call on to administer those tests? Raise your hand, Yvette. Yvette.
When you said that, it sounded. I thought you were going to say, who are you going to call? Ghostbusters. I just thought you were going to say that.
No. I called someone reliable, knowledgeable, and capable. And I needed to make sure, because I thought, you're not going to have me do the testing. You're going to have someone reliable, knowledgeable, and capable. And that was Yvette. And I was so pleased that she and Sinette Curry, who we tried to have on the show, and we look forward to having her back talking about behavioral health among youth issues, were able to come and administer those tests with a lot of confidence that whatever the results, we had a whole setup and a whole protocol, even just, just privately. So thank you, Yvette, for that as well again. And, we look forward to a great conversation, because one of the things that we know when you enter into a hospital, and today healthcare is so complicated.
Yes.
We've all had someone that we've either taken care of, or we ourselves have had to access it as health consumers, as we call it. But are we competent? Are we patient competent? Are we family health competent? Do we know how to ensure that our loved ones are receiving all the services that they're entitled to? And if there's a problem with the healthcare provision, do we have any sense of where do we turn and where do we go?
Mm-hmm.
So Dr. Byron Williams has been in that position to provide those answers. And his dissertation for his PhD was in this area. So we get the academia version, and we get the boots on the ground version, and we get the spiritual version all, and we get the practical experience all in one person. Can you imagine that?
All right. So let's bring him up. Let's with no further ado here. Let's bring him up and welcome him to the program. Welcome, Dr. Byron Williams, J. Williams, to the Marketplace Show Reset and Jumpstart TV. Welcome, my friend.
Good afternoon, everyone, because I'm sitting backstage and like, who are they talking about? I'm like, is there somebody else coming? Because I'm like, wait a minute, really? Okay. But thank you all so much. I'm so humbled to be here today. My friend Yvette was telling me about this broadcast, and she's like, you should come. I'm like, no, I'm not doing it. And she's like, yes, you're going to do it.
Really?
So she has a way of like just, I don't want to say forcing you, but she just has a way of like, I'm going to push that button and you are going to show up. Yes, ma'am.
Yeah. Well, it's and I thank you for giving that testimony, because we often take for granted, just the things that we don't see or hear, and just a little bit something like that you're not privy to that conversation, and the fact that you're here is an encouragement to that, and we really appreciate that. And I am big if we're going to create parity. If we're going to overcome those obstacles and barriers that we face as a community, as people of color, that we're going to have to really start to really pay attention and become more responsible and more engaging and proactive in this process. Because if we don't do that, if we don't start to decipher the information and to, be stewards of those information that we have to help lend and educate the public, then we're going to fail. We're going to fail, because this country, as wealthy as this country is, as wealthy as we are as a country, we're also very sick. When I say sick, in terms of health, that there's a lot of unhealthy folks walking around, not eating right, not living right, and just doing all the wrong things. And then by the time they get to Yvette, we're hoping that Yvette can work miracles. And kind of resuscitate us and save us and keep us going. But we need to have more foresight and understand that we need to do things differently. If we're going to be victorious and live a very healthy, prosperous life, it starts with education, with health and wellness. And so thank you so much, Dr. Williams, for being on the program. I'm going to go backstage, and I am going to continue producing the show. I'm going to allow my colleagues, both Linda and Yvette, to do the honors of having that conversation. And we'll talk soon. Okay.
Right. Thank you, Anthony.
Outstanding. Thanks, Anthony. And welcome again, Dr. Williams.
Thank you, ma'am. Thank you, Linda, for allowing me to come. I enjoyed our conversation yesterday. It was like amazing. So I appreciate it.
Well, let's replicate it, because let me tell you something. I learned a lot in that conversation.
Okay.
And I've had similar conversations with Yvette. And, as a health consumer, as someone who was between caring for young children and caring for an elderly person, I'm that family caregiver.
Okay.
And many of our listeners and viewers are, in fact, in those in between or sandwich years. Mm-hmm. Can you share with us a little bit, Dr. Williams? You had served as a family advocate within a hospital system, right?
Correct.
Can you share with us exactly what a family advocate, what their role is and how they interface with, is it the patients or the doctor or the
All,
family? All of the above. Okay.
all that.
All right.
I was a family advocate at a hospital in the Washington, D.C. area. And so our role was, we had multiple roles. We would have people that would come into the hospital as a Jane Doe or John Doe, and we will put our investigator hat on. Hey, where was the accident? Where did it take place? Did they have any personal effects? We would have to find out their next of kin, and then let their family members know, hey, your loved one is here in the hospital. We also, as Anthony was speaking to about the knowledge of the healthcare system, we had people that were just reluctant to come to the healthcare to have healthcare, and when they got there, because we didn't have primary care physicians on a regular, we didn't go see a doctor on a regular basis. We had people that used the ER as their primary care. And so when things would happen as a family advocate, God forbid, but if someone lost a family member, our role was to go to the family and say, hey, what's your next move? Who's the legal next of kin, and who's going to make the arrangements for their loved one from this point on? And that whole education piece, that's a whole nother topic in itself, because you'll have families, especially people in the community of color, they don't want to talk about, what happens when somebody dies. They don't want to talk about when someone gets sick. We don't want to talk about that. And so, of course, when it does happen, we're not prepared. We don't have the funeral home arrangements made up. Sometimes we didn't even have the life insurance. And so I would deal with sometimes family members having to leave their family members in the morgue 10, 15 days, 20 days before somebody could, have made arrangements to take care of them. So we would be the go-between for those families and say, hey, here are some resources that we have here at the hospital that you can reach out to help your family with this transition of your loved one. We would also, patients that may have come to the hospital and may have felt like they didn't get the proper care. They would come my office or contact our office, and we would, advocate for them. We go to the doctor or the nursing station, and just find out what was going on. And what we tried to do is try to be like the mediator before it got to the administration level, because of course, when things happen at the administration level, it's a totally different if you can handle it, in the unit. So that's sort of the things that we did as a family advocate. We basically was the go-between between the families, the medical staff, the funeral homes, the medical examiner's office. So we did a little bit of everything. Yep.
Is this a typical position at every? I mean, this sounds like a dream position. Who knows about the family? I mean, you know about the family advocates because you probably had to answer a couple of questions here and there. But as someone who's a health consumer who worked in the Ivy Towers of the hospital system and not at bedside, not doing the rounds, we get the complaints on that side of the house, but you're resolving it before it gets to that level of a complaint, is what I'm understanding.
Correct.
Is this a typical position at hospitals like nurses and doctors, or is this a
they do have
phenomena?
I mean, the hospital that I worked at was one of the largest hospitals in DC. So because of that, you had a lot of people that had issues. And so, they had family advocates there. I think you will have them more at the larger hospitals. I think now they call them like patient navigators. So they would have that role at the larger hospitals. The more like community hospitals, because they don't, I would say more so like hospitals that were level 1 trauma, level 2 trauma hospitals, you would find those advocates at those hospitals. The community hospitals, some of these duties were handled by maybe the nursing supervisor, medical records. So at the smaller hospitals, but the larger ones, you definitely have them there.
So at what point should is this someone like now, from now on, if I ever had to go into the hospital, one of the first groups of individuals I'm putting into my, on the board in your hospital room, you have your
Yeah.
nurses and you have is going to be the name of the first, is the nurse navigator or the
The
family
patient advocate or
or
family
patient
advocate.
So they're
Yeah.
all one in the same type of position.
Yes.
Primarily just depends on the level of hospital response. So patient advocate, nurse navigator, or family advocate, right?
Correct.
Okay. I'm having their department number on my board because, who knew that this position was available? How do we
Right.
get in touch with these individuals? Is this something that's referred to us when we first go in, or the family comes, or, how does this happen?
Most hospitals, if they have a family advocate, nurse navigator, even the social worker should know. The social worker and most time patient advocates work hand in hand. So yeah, so that's the next number is the social worker. If it's an issue that is long standing or some level of seriousness, yeah, definitely the social worker and patient advocate work well together.
Great.
Mhm.
Linda, I wish we had time, and you'll have to talk with Byron offline. He'll have to tell you the stories of the missing baby and the story of the two wives.
The missing baby story and the
He
story of
has
what-
done some work as a patient advocate that most of us would run from.
Well, it's kind of like if there's a Cliff Note version, because this is such a critical position that I'm not sure is widely known. And perhaps right now we have listeners and viewers who are thinking, I got a loved one in the hospital and I cannot get the right food, or I cannot get a response from the doctor, or I was told I was going to be checked out today, but I'm still in my room and now it's getting late. Am I staying or I'm not staying? I don't know if these are some of the issues, but I mean, I'm sorry, two wives and a missing baby story. Are those one and the same?
No,
Two different stories.
two different stories.
Oh my goodness. Well, I think we have a little time. Is there a Cliff Note version of that? Because that is remarkable. Because that's a good example of why advocates are critical in this healthcare landscape.
Yeah, advocates are critical. I tell the two wife stories. Had a young man basically had come into the hospital, shot multiple times. It was a late Friday night, Saturday night. Came in, shot multiple times. They took him to the ER. A young lady came in and said, I'm the fiance. So, and she was pregnant. So I'm like, I didn't question that. She said she's the fiance. So at this time, it's like midnight, 1 o'clock in the morning. And so security calls me. They was like, hey, Reb, you got to come down to the main lobby. I'm like, I'm trying to get some sleep. But anyway, so I go down to the main lobby and it's like, hey, this lady says she's the wife. And I said, oh, okay. So real quick, so I said, and normally we didn't ask for ID. If you say you're the spouse or the fiance, we didn't question it too much. So I said, ma'am, if you don't mind, first of all, it's 2 o'clock in the morning. Now, if your spouse has said, or you got a call from the hospital said your spouse was injured and you get into the hospital, right? It's 2 o'clock in the morning. You're going to have your bonnet on, your house shoes, sweatpants or something. You're going to go.
Yeah, you might look that way.
This sister was flawless at 2:30 in the morning. Hair done, makeup done, stilettos, everything. So I'm like, where's she coming from or where she's going? So anyway, so I said, ma'am, do you have ID? She pulls out her driver's license, her passport, and her marriage certificate. And I said, who walks around with their marriage certificate? So anyway, so I said, okay, she's the wife. So I get to security, say, this one, the fiance, she's got to go. I don't want to have somebody else in the hospital. I said, she's got to go. So she was like, no, I'm going to stay because, when he comes out of surgery, I want to be at his bedside. Ma'am, he's going to ICU. You're not going to be able to see him. You got to go. I said, because if this other one finds you, it's going to be a problem. So I finally got her to leave. And so I go back to the wife. And of course, I was able to bring her to the ICU because she's the wife. And on the way up, she goes, has anyone else been here to see my husband? And I said, well, the police have been here because, they've done they're doing an investigation about what happened to him. But yes, the police have been here. And,
Good answer.
so you got to know how to, word things so you don't cause any other problems. So.
Wow. Oh my goodness gracious. And,
Yeah.
I'm not even going to ask about the outcome, but hopefully he survived, they survived, and the baby survived with the other lady. But that just brings to mind the fact that no experience is one and the same. There's no probably there's some general job description for what you used to do as a family advocate in the hospital, but suffice to say, it keeps the calm and it keeps the patients and their families moving in the right direction, and that is to get a good health outcome.
Absolutely.
So tell us before Anthony comes back on, tell us a little bit about this. This is such a broad topic and such an important topic that you selected it as part of the focus of your PhD study.
Correct.
Can you tell us why?
Well, so my study was on how budget level decision makers strategies in the wake of healthcare uncertainty. So as awesome as I was as a family advocate, after I started my PhD, the hospital laid me off. And one of the reasons they laid it off was because this one Affordable Health Care Act was coming out, and they were like, well, we don't know, what the status is going to be. We don't know. So actually about myself and about 300 other people were laid off. And so I was like, well, I'm gonna have to do something different, but I'm still going to do this study because I thought it was relevant, especially to like veterans at the VA hospital. So I was like, well, I'm gonna still do the study. So I thought it was important because of the Affordable Health Care Act. One of the things I wish the administration had stressed was that as taxpayers, people that show up to the hospital that don't have health insurance, we as taxpayers pay for that, right? So we pay for that. But guess what? The more and more people that have their own health insurance, that's less money that current taxpayers have to pay. So that's money could be taken and used for infrastructure, or it could be used for, education. The money could have been diverted other than us having to pay for uninsured patients to continue to come to the hospital. Yeah. So that was my focus behind that. And because I kind of wanted to, because I was laid off, I was like, no, I want to prove that this Affordable Health Care had nothing to do with us being laid off.
Yes.
So that's what I started it. That's what started it. So.
Wow. Well, and should we say congratulations are in order because has it been a year? You graduated in 2020?
Yes, it was a year. And my degree got conferred on May 31st. It was my dad's birthday. And so that was so special because my dad passed away after I started my PhD program. So it's actually on the degree May 31st, 2020.
Nice.
So it's my dad's birthday. So I was like, okay. I was there.
Well, it's remarkable because just to achieve that level of education, and to be the subject matter is so important because one of the takeaways that I got out of what you just said, outside of go as far as you can go in your education, particularly as a person of color, which is outstanding and phenomenal, is that we need to ensure that everyone becomes an insured individual in the United States of America. And
Absolutely.
that it's just that it's the Affordable Health Care Act, no politics involved. Go out to the local exchanges because is that where individuals who need to find health care would go to their state exchange? Is that
correct?
Kind of how that works?
Go to the state exchange. Yes, they can go to the state exchange for that. So and I know some people have some reluctancy, but in my study, one of the things that I found out, I used a hospital in Virginia, and the CEO of the hospital, because Virginia was one of the states that opted out of the Affordable Health Care Act.
Oh, okay.
They did not take advantage of the first 2 years where the federal government was going to fund it. And so even though one of the hospitals that I did my research was a very well-funded hospital, the CEO was like, there's millions of dollars that we will never get back. He said that's millions of dollars that we could have used for community education, for new equipment, for new building, to hire the best staff. He said that's millions of dollars that we will never get back and be able to use. And so I wish more people had, because they politicized it so much,
Yeah.
it did not get to the crust of the matter about how much it would help local hospitals, especially hospitals where you have 60% of your clients are Medicaid, Medicare. So yeah, so but yeah, so I'm glad it's out there. I'm glad they couldn't undo it.
Yes.
So I'm glad that people are taking advantage of it now. There's over 20 million people now that didn't have health insurance that have it now. So it's great.
You know,
That's outstanding.
we're scheduled to take a break at the top of the hour.
Okay.
But before we do, and kind of just really paying attention to the conversation, and I've said this before, so if you hear me say it again, it's repetitive or repetition. It's important because it reinforces the information. When you really think of it, we're in 2021. The cost of healthcare, when you put a price tag on what is the current value for the healthcare industry, it's literally shy of $3 trillion today.
Mm-hmm.
When you think of the GDP, the gross domestic product, or the economic output of the healthcare industry in the United States by ourselves, just the United States, no other country, just the United States, it's shy in 2021, shy of $3 trillion. It is projected by at least 2025, between 2025 and 2027, that number is going to double. The cost of healthcare is going to go to $6 trillion in the United States. And one would want to know, well, why? Why is the cost of healthcare to deliver healthcare is going to be so expensive? Why is it going to double? Because more and more people are going to become sick.
Yeah.
And the cost of delivering healthcare is going to become exponentially more, expensive to do so. And so therefore, the only way we can mitigate that is through prevention, education and prevention. And so this is the genesis. The conversation that you're seeing and hearing is that conversation that is going to be had to be able to find out how do we effectively avoid healthcare going to $6 trillion. And so it's a problem. But when we come back, I just want to kind of sort of throw my little 2 cents on the conversation and really talk about the whole economic impact, because we are about the economy, business and markets and consumers. So I want to thank you, Dr. Byron Williams, for being a contributor, a special guest on the program. And of course, Linda, and you guys are doing a great job. We'll take a break. This is the Marketplace Show Reset and Jumpstart TV. We'll be right back.
Right now, 91 million Americans are financially overlooked. 48% have a fear of finance. 2 in 3 lack the ability to manage their finances. We solve this issue by combining financial literacy and financial management into one seamless app. 1. Have your financial goals align with your values. 2. Track your money and forecast how big decisions will impact your virtual accounts. 3. Build financial literacy at your own pace. Our competitors are rigid, disconnected, and impersonal. They represent the old way of doing finance. That's not who we are. We personalize your finances for you because we know one size does not fit all. We're democratizing personal finance. Join the tribe at Core Finance.
Small business is a part of all of us each and every day. It's where we eat, it's where we shop, it's where we go to meet our friends and colleagues. In the wake of COVID-19, our small business community desperately needs our help. We must do our part to help our local communities to once again thrive. We must focus our attention on the small businesses that are the fabric of our great nation. SureUp is a network of small business owners, their employees, and local consumers all working in unison to support each other. By creating incentives for consumers to think local before considering regional and national providers to fulfill their needs, We create local job opportunities and rebuild our communities. In addition, through AI-driven tools and machine learning, in just 5 minutes a day, SureUp assists business owners in improving their social media presence, which enhances their visibility among consumers and levels the playing field so that local businesses can better compete with large, name-brand online competitors. When local businesses leverage the SureUp platform, full-time and part-time employees, whether W-2 or 1099, are rewarded with a variety of voluntary perks and member benefit options. These include discounts on the things people do every day, access to low-cost, subscription-based telehealth and teletherapy, discounted prescription drug plans, connection to exclusive Prosper resources, and so much more. All for less than the cost of a cup of coffee each day. The Jumpstart Marketplace is here to support the health and wellness of individual employees, as well as the health of businesses in the local communities in which we live and work. We're all in this together, so join us as we reinvigorate our local community and improve the physical and financial health of working America.
Okay. Welcome back to the show. We are glad to have you, Dr. Byron Williams, and my new co-host, Yvette Wood. So when we left, yay, that's exactly right. That's exactly right. When we left off, actually, when we started the program, we talked a little bit. Anthony mentioned that this month is National Men's Health Month in the United States. For those who listen outside the United States, we commemorate different health topics. And this month, we happen to be commemorating all things related to men, because men are complicated, wouldn't you say?
I can go
Very
now.
complicated in a nice way. And part of that complication is not wanting to go to the doctors.
Yes.
Not wanting to get their checkups.
Yes.
Not taking full responsibility for their health. If there's nothing wrong, then everything is right. But that's not necessarily true until it all appears. So in addition to your 2020 and receiving on May 31st, your father's birthday, which is a wonderful remembrance, your PhD, you share with me a story about entering into the final phases of your PhD, which is presenting your dissertation and defending it.
Right.
Can you tell us, because your 2020 was on extra, as the kids would say, it was extra. But can you tell us a little bit about some of those extras as a health consumer, as a male health consumer?
Yes. So January 21st, I submitted my final dissertation for my committee. I was like, I'm done. So let them do what they're going to do, but I'm not writing nothing else. So 2 days later, I suffered a stroke. After I turned it in, I was like, oh God. So of course I still left to defend the dissertation.
Mm-hmm.
So I had a stroke, was in hospital 6 days. I went to rehab, was in rehab 19 days. That's a whole nother issue in itself because, technically you can only stay 21 days. If you suffer a stroke, you go to rehab 21 days, you got to go. You got to either go to long-term care or you got to go home. They do not.
Oh, I didn't know that.
Yeah. When you're in rehab, you got to, if you still need the rehabilitation services, you either got to go to a nursing home or your family has to take care of you at home and you have to go outpatient rehab. So that's a whole nother issue in itself because there are people that get pushed out.
Yeah.
They really need to stay there for another 30 days, another 40 days. But 21 days, you got to go. If your family wants you to stay beyond that, you really got to fight. Anyway, that's a whole nother topic in itself.
But can I ask you a question about that?
Yes, ma'am.
For those who are interested, my father, suffered a stroke and did not survive it, but so he didn't have a chance to even go into rehab. But you're saying, is that a rule of the insurance companies, or who's driving that 21 days? If you can answer
Oh,
that particular question, so we'll know
insurance
who to
companies.
advocate differently. Is there?
Yvette can tell you. Insurance
That's
companies.
definitely the
Oh.
insurance companies. They
Oh, yeah.
regulate how much time you spend for each disease process that you may suffer. I have seen people have brain surgery and get kicked out in 4 days. And most people consider that pretty major surgery. You have to go. They regulate how much time your doctor spends with you. The next time you have an appointment, pay attention as to how much time that doctor spends in the room. They're usually allocated 15 minutes per person.
Yeah.
And that's all they're going to get paid for. So they try to get everything you need done in that 15 minutes because they don't want to lose money by spending more time with you.
Oh my goodness. And that plays right into your dissertation and the economics of it. And, you know, and therefore economics dictates quality healthcare delivery when it really should be not even associated. We understand you got to pay for healthcare,
Right.
but we also understand that you cannot do this in a minute. There's no magical wand. So you stayed your 21 days and then
No, I didn't even stay 21 days because I was on day 19 and I was in the rehab gym and working with my therapist, and the social worker and the doctor comes in. They said, no, I was on day 18. Social worker and the doctor comes in and says, well, you're making good progress. So the insurance said, because you were able to walk 100 steps with a cane, you have to go home. So that was day 18 in the middle of my workout. They come and says, tomorrow's your last day. You got to go home. I'm like, what?
Oh my goodness.
Even my therapist was like, yeah, he's getting better, but he's got to go home. She was like, no, he needs to stay his full 21 days. They said, nope. Insurance said he is able to walk 100 steps with a cane. He can go home.
My goodness.
Right.
Yeah, that's a conversation. We'll have to bring you back and talk about that. My heart be still. I think everything inside of me just depleted because that makes me so sad to know. And we'll talk another time about how do we advocate for change within the insurance industry that really is centric to quality healthcare delivery and recovery and treatment plans without it being an economic issue. So now you got us intrigued. We're at day 18 and you're getting ready to get pushed out at day 19.
Bye. They was like, bye. I don't know where you're going, but you got to get out of here. So I go home. And during that time I was in rehab, I was still in touch. And I'm just so grateful that I still have most of my mental faculties. And I just was totally paralyzed on the right side. I couldn't hardly move on my total right side was down. And so I'm still talking to my mentor. He's like, hey, you know what? You got to defend your dissertation. I was like, I do? He's like, yeah, I told the school that you had a stroke, but you still got to defend. I was like, oh, okay. So, of course, so my daughter helped me prepare my slides for my presentation. So I went through my slides, and on March 20th, 30 days after leaving rehab, I defended my dissertation. Okay. And so I was able, because my dissertation was on Affordable Health Care Act, I was able to work in my own condition to my dissertation about healthcare, about how, and I have decent health insurance because I'm retired military. So I had decent health insurance. But in my dissertation, I told them my healthcare to this day, from the time I got sick to I left rehab, we're talking almost over $90,000. And my portion of that was less than $300. So I'm like, so just imagine people who have the 80-20 rule. Yeah, we're going to pay 80%, but you still got to come up with 20. So just imagine, they always tell you what, you got to have 6 months in reserve, right? Well, most people now, if they got 1 month reserve, they're happy. So now, and hopefully you have a job where you are able to take short-term disability. So I was able to do that. My current employer had short-term disability. So I was able to still get some money from my employer and still had great health insurance. But just imagine folks that don't have health insurance, or they have a job where there's an hourly employee and there's no benefits and you're out of work. Now you don't get paid and you got this huge medical bill. That's going to make you sick, if nothing else, So But then on the flip side, when I was in rehab, there was a gentleman who was homeless, and he was in rehab, and the hospital system had to eat that cost because the one thing they did not do was just put him on the street. He had nowhere to go. So he was a stroke victim, no place else to go. So the hospital had to eat the cost for that. The rehab center had to eat the cost of that. And then they sent him to, a nursing home. Yeah. So I guess between Medicaid and that medical facility where he was, all of those folks had to, eat that cost for his recovery.
And those are called safety net hospitals and service provisions. That's the safety net of society that we contribute to as tax-paying citizens.
Right.
Exactly, Linda. And I was going to say that's where the disparities in healthcare comes in as well, because this patient he's talking about was considered Medicaid. He was going and probably sent to a Medicaid facility, which gets subpar care. He is not getting the great rehabilitation services that he would as someone who was insured. So that's another disparity in healthcare.
There you are. Okay. Yes. And so this is so fascinating. So this is a story of perseverance as I've never heard. I mean, so on the 20th of January, you had a stroke. You spent 18 of the 21 days that you were entitled to in rehab. And then how many weeks later you were somewhere standing up, sitting down, lying down, or I don't even know, communicating and defending something as momentous as your dissertation.
Yes, my dissertation is only 184 pages. Not that I'm counting.
Only Dr. Williams. Okay.
Yeah. Yeah.
All right. Oh my goodness. And so obviously, and then by May 31st, you were hopefully walking across the stage unassisted by a cane or by a cane, having
because of
stroke.
Because of COVID, we didn't have an in-person graduation yet. So it was a virtual graduation. But they still claim we're going to have a in-person graduation. I don't care where it is, I'm going.
I appreciate that. So, because of Men's Health, can you share with us, maybe hearing the baritone in your voice will communicate to the men who are listening. How did you know that you were having a stroke? What were some, because it can be very subtle for some individuals.
Very subtle. It's very subtle. Well, I'm going to tell you the story is at that time, my son was 10 years old. And I want to say maybe the Saturday before I had this stroke. Yeah, the Saturday before I had this stroke, he came and said, "Hey, Dad, I had a dream." And I said, "What's the dream?" He said, "I don't want to tell you." And I said, "No, man, you can tell me." He said, "I had a dream that you died, and Mom had to tell me that you died." I said, "I'm not going nowhere, man. I'm fine. No problem, right?" So that next Thursday is when I had my stroke. So I came into that week, and I just thank God that I was able to pick him up from school, took him bowling. We got to the car, we got in the driveway of the house, and I get out of the car, and all of a sudden I went to pick up my gloves and I couldn't pick them up. And I was like, that's strange. So I said, okay. So I couldn't pick up my gloves. And I said, well, let me go in the house. And I stood there for about 5 minutes. I said, something not right. I'm not in pain, but my arm is going limp. And then I looked at my son. I said, I got to call 911. I don't know what's going on. I wasn't in pain, but because I couldn't grab anything, I was like, okay, something's not right. So like 5 minutes later, I looked at my son and said, I called 911. So I called my daughter and said, listen, I'm going to call 911. I don't know what's going on, but I don't feel right. And so, that interaction with my son made me say, okay, I got to call, because I promise you, if he was not with me and if I was home by myself, like normally I would be on the days I don't have him, I probably would have sat in a chair, like, oh, it'll go away. Let me take a Tylenol or something. But I was able to get to the hospital within the 4-hour window for the clot buster medication. So I just thank God that happened. And the hospital was only 5 minutes from my house. And so just everything lined up to get myself taken care of. Because if it wasn't for that, I'd probably been still sitting in a chair now.
Can Nurse Wonderful Yvette Wood, can you explain to us what Dr. Williams just said in terms of the 4-hour window? What does that actually mean? Because that's a remarkable story of knowing thyself and then acting on thyself, and the signs and the wonders are just the added bonus. But I'm so glad you did that. So therefore, what does that mean? You mentioned 4 hours.
Right. When you have a stroke, there's certain medications, and it's a time. It's all about it's a race against the clock. From the time you have that stroke to the time you receive certain treatments as to the outcome. So the sooner, the better. As long as you get there, like you said, within that 4-hour windows, they administer this medication, you're expected to have a complete, reversal, or at least half reversal, and a much better outcome than if you come after 4 hours. Sometimes after 8, 9, 10, they don't even try those medications because it's too late. That's why with healthcare, and Dr. Williams, thank you for being so proactive and taking care of yourself. And I would like you to speak to the men that are listening and explain to them how important it is when you're not feeling well to get to the doctor and to go before you get to the point you're not feeling well, that you have to be proactive. And I think that your experience as a patient advocate probably gave you some knowledge, some medical knowledge, am I right, about what was going on with you?
Absolutely. And I wanted to, before we went to break, Anthony mentioned that. And one of the things when he's talking about just being more aware as a community, as a family advocate, I've had a patient that came in who had a heart attack at worked for the federal government. So he had good health insurance, right? Unfortunately, he passed away because of the results of his heart attack. So I had to go to his family, speak to the next of kin. I said, okay, we need to find out his primary care physician. The gentleman was only 50 years old. And it was like, oh no, John took pride in not going to the doctor. He probably hasn't been to the doctor in 20 years. Like, what good is it to have health insurance and you're not going to take advantage of it? So that goes back to what Anthony was saying. You have health insurance and then you don't use it. And this is something that could have been prevented. At 50 years old, you drop dead from a heart attack, and because you didn't go to the doctor on a regular basis. That just defeats the point. But yeah, back to Yvette's point. Yeah, because I think working in that environment and seeing people who did not go to the doctor on a regular basis, I know for me, I started doing that because we're in the military. They're like, oh no, something wrong with you? Oh, your toe falling off? Okay, we'll just wrap it up, keep going because we got to go. The mission is essential. You'll worry about that later. And so I was kind of in that mindset till I started working in the hospital. It's like, okay, now if I want to be around, now I got a grandbaby. So I was like, if I want to be around to see her graduate from college, I better go to the doctor on a regular basis. So,
it's funny to say because I was having a conversation this morning, and I noticed, and I'm speaking just for St. Croix, nowhere else, just St. Croix, right, in the U.S. Virgin Islands. And I have literally seen over the span of maybe, let's say the beginning of the year, the beginning of 2021, that I'm seeing a trend of more young people dying.
Mm-hmm.
And I'm like, this is rather disturbing because, there's life expectancy, right? There are those who with underlying health conditions, chronic disease, whatever, I'm diabetic, I'm very transparent about it. I'm type 2 diabetic. And so I've had to live my life, in a whole different way for several years. But I'm 56, right? I'm 56, and I'm watching young people who are in their 20s and 30s, dying. And before it used to be, it's just young black men who are thugs, criminal, in gangs, in drugs, killing each other, right? Killing themselves, right? Or getting into, just nonsensical type, motorcycle accident, whatever. We're not talking about that anymore. We're talking about young females.
Right.
Young females that are dying before their parents.
Mm-hmm.
Young people who have children, a family, and dying, they're leaving the family behind.
Yeah.
And I'm like, is this just the Virgin Islands? I'm not the Virgin Islands. Is this just is this St. Croix in the U.S. Virgin Islands, or is that happening elsewhere as well? Because I'm a little bit, it's a little bit disturbing to me.
Mm-hmm.
Anyone? Have you seen that anywhere else? Is that trending anywhere else?
Let me just add. Yeah, let me just add to that. Where it's just not the U.S. Virgin Islands, I think that we have enough data in the U.S. mainland to really qualify that as just about most major communities in the United States. And particularly if we drill it down to communities of color, we know that health disparity.
Yeah, Linda's having some issues.
Yeah, I'll agree with what Linda was saying, that the health disparities, especially in young African Americans or just people of color, period. You look at the Latino, the Hispanic population, just go to social media, look at Facebook, you go down people's line, you trending rest in peace more than you are good morning. People are leaving left and right. And a lot of it has to do, again, Anthony and Linda and Dr. Williams, as we discussed, education. And they're just not taking care of themselves. They think they can do whatever they want, whenever they want, and consume mass amounts of alcohol and take pills and eat all kind of unhealthy foods, and it's going to be okay. And it's not that way anymore. You have to pay attention to what you're consuming and how you take care of yourself. One of the things on the rise is actually hypertension. And you've got 20-year-olds with high blood pressure, 17-year-olds. And if you go into pediatrics, and most of them are men of color, boys of color, are young men, because they're sitting up eating McDonald's and Wendy's and sugar and soda every day. And it's just not healthy. And the parents aren't doing anything about it because they don't have the education as well. You will find that a lot of diabetics, people of color, it's in the whole family, and it can be generational, because they don't change the way they eat.
Yeah, the good book says, right, that my people perish for the lack of knowledge. Ignorance is no excuse, and so clearly, we got to do better. We got to do better to educate ourselves, because only through empowering ourselves is how we're going to win this. We're going to lose battles, right? Some battles you're going to win, some battles you're going to lose. But guess what? You got to keep your eyes on the prize, because you want to cross the finish line the way you want to cross the finish line. So, Linda, unfortunately, we're out of time.
And Anthony, but this is really, we got to say one thing, because you're both men of color. And I know that Dr. Williams also talked about one of the other sub areas, and that is prostate cancer. So we're just going to ask all men to please go and have your prostate checked. And address this particular health disparity. And Dr. Williams, we can bring you back on to talk about your experience with prostate cancer, because you're a survivor of many things, and we appreciate that. And yes, Anthony, we do have to go, but it's been a good conversation today, wouldn't you say?
It has just been an enlightenment for me to be able to I feel a sense we've accomplished, or we are accomplishing our mission in what we're doing in terms of making a difference, having that impact. And so, yes, I concur with you and look forward to many more returns by Dr. Byron Williams and his contribution. I know he doesn't like the limelight. I get that, but listen, we need you. We need all hands on deck. We need everybody on the front line fighting the good fight. So the good doctor, Dr. Williams, we need you back. We need for you to be an ongoing contributor on this discussion, and I really appreciate it. Yvette, phenomenal. Thank you so much. You know exactly how to pitch in when Linda was having her issues on with the technical issues, and so it's like you know what you're doing. It's like you're ready for this, and so this is what the teamwork is all about. Everybody covers their position, and we'll get it done. So thank you so much, guys. All right, folks, this has been the first segment number 1 of Health and Wellness of the Marketplace Show Reset and Jumpstart. I'm Anthony Weeks. And let me thank my colleague Linda Dorman and Yvette Woods and our guest, Dr. Byron J. Williams, for being on the program. Until next week, we'll talk soon.
Thank you.
Thank you.